Welcome once again to Ask Me Anything on Diabetes with me, Dr. Aniket Banvi. Well, we are glad that we have been consistent and we are on the track to educate people on diabetes and help them in understanding about diabetes and bring an awareness in and around to manage diabetes in their life. Now, as we have extensively spoken about diverse topics in understanding of diabetes and its management, what brings us here is that once again, to give you an statistical understanding of where we stand in India at this point of time about diabetes, well, extensively, the amount of number of living in India have been increasing. Now, the very interesting fact here is that you need to understand that the number of diabetics are very less in India and the number of pre-diabetics in India are more in number. So there are people who are in the verge to be a diabetic. They are almost in the border where they can be healthy and they can be also in a disorder, disease, or metabolic dysfunction, or any of those things. Now, it is at this juncture that you need to understand that you have the power to take charge and bring a change in your health. It is absolutely in your hand, in your lifestyle, to make those change and bring a significant amount of change to make sure that you don't end up being prey to any of the chronic lifestyle diseases that we see and that we hear. Now, if you have somehow gotten the sense, or you have been diagnosed as pre-diabetic and are on some kind of a medication or on some kind of a journey to manage your diabetes, here are three things that you should absolutely understand in this whole journey. The number one mistake that a person who is initially in diabetic reversal journey makes is that he loses his weight. Weight management is absolutely crucial, but it is also, people lose their weight in a very wrong way. You need to understand that when you are in the journey of reducing the amount of overweight that you should keep in your mind that you are also making sure that you are not losing your muscle mass. Yes, I'm saying this because muscles are the integral part in metabolizing your glucose, helps in regulation of your blood glucose predominantly. So many a times when people are diabetic, they usually lose their weight. What they also lose in this process is that they lose their muscle mass. And when you lose your muscle mass in the same journey, you will see a significant amount of disproportionate and also a dysfunction in your diabetes management level. Even though many diabetics, when they come, they say that, sir, I've lost my weight, but still my diabetes is not being controlled. I don't know why. The reason is because this, that you need to understand that the blood glucose metabolism needs the muscle mass. When you are losing your weight, you need to make sure that you're losing your body fat or the water retention that has been holding and increasing the inflammation in the long period. In that point of time, you should also make sure that you are not losing your muscle mass. Make sure that you work on your strength training so that you keep your muscles intact and do not lose them. That is the very number one thing. The number two thing is that many people end up in micro deficiencies, micronutrient deficiencies. Many patients I have seen and consulted have come up with the reports of vitamins and minerals deficiency. Now, you need to understand that when there is an excess amount of vitamin and mineral deficiencies seen in the body, maybe most predominantly that we see in diabetics is vitamin B12, vitamin D, and many other such diabetes, many other such vitamins and minerals diabetics going through this journey. Now, you need to correct these things at the very first front. The reason we are saying is because all these vitamins and minerals are the raw material to regulate your blood glucose level normally. But apart from that, they are also working in many other biological pathways and helping you run your body smoothly in an homeostatic system. So make sure that you keep the understanding of your deficiencies correct those deficiencies, and that will eventually help you in managing your diabetes. And the last part is that about stress, which I had spoken extensively last time also, but nevertheless, you need to understand that managing your stress is very significant. Many diabetics have increased level of cortisol, which is said to be the stress hormone. Now, anything in your body excess is going to damage your body. The same way, stress is going to damage your blood glucose level. And you need to make sure that you are learning the various ways of managing stress levels so that you are able to manage your diabetes level in a significant way in the long term. And these are the things that you should be carrying forward, and these are the three major mistakes that people do in the journey of managing their diabetes or pre-diabetes. So make sure that you work on these three things correctly, understand that, and then take the right measures to manage your diabetes in the long term. Now, this is something that we wanted to share. Now let me come to the questions that has been asked by various people. There is someone who has asked me saying that at what stage insulin should be started. Now, not just me as a doctor, we cannot generically say, or I cannot blabber saying that you can take any time the insulin whenever it is required. No, it is not the right way. You need to go to a consultant, sit down and make an understanding of whether it is necessary for you or not. Are there any ways that we can reduce the amount of insulin and correct your lifestyle, and so many other factors? So the very question that you have asked itself is very wrong, I believe, because the concern should be managing your diabetes, not about taking external insulin from the outside, rather than knowing and learning how to rejuvenate your pancreatic beta cells and naturally produce the insulin production from your pancreas. And that is how you should be looking at. So make sure that when you ask a question, you have understood or studied the whole ecosystem of how your body is functioning and how your body is functioning, and whether it is the right and appropriate way that you should be taking charge of. Now let me come to the very next question. Now, these are the very few things that we are sharing here. In spite of all this thing, you should definitely go and study thoroughly, get in touch with us, get a consultation if you require. You can log on to our website, knockdiabetes.com, and have a one-on-one consultation in specific to your things, in your specific, disease or the diabetes management. The questions that you have, you can come to one-on-one consultation and you can ask us and we'll answer them. Now, tell us the treatment for diabetic neuropathy. A very interesting question. Diabetic neuropathy is nothing else but the nervous system. The damaging of the nervous system happened because of the diabetes is something called as diabetic neuropathy, where your nervous system is compromised, is collapsed, and is being damaged because of this. Now, how do you manage neuropathy? Especially, you need to know that it affects the end nerves, or the symptoms are seen at the end nerves initially. But what you need to understand is that not just the end nerves, but the entire nervous system, which is across your body, just like a electrical wire network, it is being damaged, every other part of it. You only see, or you only get to feel the pain or the tingling sensation, the burning sensation in your hands and feet, because they are the end nerves predominantly. And that is where you are mostly affected. Now, to tell you why people are facing neuropathy is because of diabetes. Because when the nervous system is collapsed, what happens is that the inflammation increases, the nerval debility increases, and you are not able to function properly. And once a person has a stagnant elevated blood glucose level for more than 3 years to 5 years or up to 8 years, he or she will definitely end up having some amount of diabetic neuropathy, unfortunately. And it is a compulsion that everyone should face it. Some people face it, some people not face it. Some people might end up in neuropathy is there, then retinopathy is there. there are so many other means where it can end up and cause sort of problems. So the number one thing to manage this whole procedure is to manage your diabetes in itself. Make sure that you're controlling your blood glucose levels in a very normal ranges, so that you do not stay in an elevated blood glucose level for a longer period of time, which leads to damaging your other parts of the body. That is the number one thing. So to do that, you should be physically active, you should be eating clean, and have a sort of proper sleep hygiene. Sleep health is very important, all of these things. Now there is one more thing that is very predominantly seen in diabetics, is the deficiency of vitamin B12. Vitamin B12 is directly linked to the nervous system predominantly, so and specifically. So if you're also a person who is having vitamin B12 deficiencies, then you should be looking up for that, because that will lead to the progression of diabetic neuropathy. Many a times we were able to subside the amount of pain in hands and feet because of, correcting the vitamin B12 deficiencies. So if there is any deficiencies, please do correct them. That will eventually help you in correction of neuropathy also, specifically vitamin B12. So this is what you should be understanding, and this is what it is all about. So this is the way you should be treating yourself, or at least in that direction, to walk in that pathway, so that you help yourself, or you take the guidance of the consultant, sit down and discuss with them. I don't know how many physicians sit down and discuss with the patient and educate them at what and how each and every other aspect of his life is affecting his health, and what is the reason why he is there in that position, why he's a diabetic at that very first place. In spite of that, you need to make sure that you educate yourself, understand, discuss, ask questions to the doctor, so that the person is able to give you a proper answer and help you in understanding what you're going through. So with that, I'll take a leave, and I will see you on the next live. We will be conducting various webinars and other such live sessions. Make sure that you follow us across our social media, so that you can join us whenever we are live, or when we conduct various webinars. You can sign up and join us and have a chat with us, or listen to us and understand how to manage your diabetes in the long term, and not just managing your diabetes, but also knock your diabetes from your life. With that, I'll take a leave. Have a good evening. And with that, we will be coming to an end. See you on the next live.